Baltimore mass overdose incident, July 10th, 2025 in Baltimore City. Whatever you do, stay away from drugs. Thank
My name is James Wallace. I'm Chief of the Baltimore City Fire Department. I'm joined today by Deputy Commissioner Kevin Jones from the Baltimore Police Department and Miss Sarah Whaley from the Mayor's Office of Overdose Response. So at about 9:20, 9:25 this morning, Baltimore City Fire Department units were dispatched in this area. We're at Pennsylvania North right now. They were dispatched into this area for a report of an overdose. One of the units that also responded was our community paramedicine unit, which was actually on the way here. They're one of our outreach units that works in this area. They were actually on their way here as well. Our initial units encountered what they believe to be, at this point, a patient experiencing a drug overdose. However, they were approached by numerous members of the community who directed them to additional people in the area that were found to be unconscious. They reached a point early on in this call where they actually were encountering up to 4 patients. At that point, realizing we had a much larger emergency, they quickly upscaled response of both police and fire. As of this point, we've transported 15 patients, at least 15 patients, to the hospital. 5 of those patients are classified as priority 1 patients, which means those patients are critical. 10 of those patients are priority 2 patients, which are still serious, but of lesser condition. We do continue to find what we suspect are overdose cases in the area, and we're dealing with that. Out of that 5 and 10 that I just gave you, that number will very likely change in the next hours as we get some more data, but that's where we are right now. The Baltimore City Fire Department has deployed 13 medic units to this particular incident. Some of those medic units have actually gone to the hospital and returned back. So those patient engagement numbers are higher, but we've used 13 medic units as well as 4 different fire suppression units, a multitude of EMS officers, as well as a battalion chief and our shift commander. So at this point, we're standing by as Director Whaley's team works, as Deputy Commissioner Jones's teams work. I'm keeping resources in the area in case we discover any more patients. I'm going to stop here. I'm going to ask DC Jones to step up and say a few words.
Yep. Good afternoon, Deputy Commissioner Jones, BPD Operations. So, as the Chief just said, when BPD arrived to the scene, we're treating the scene as an active crime scene. We're utilizing our investigators as well as every crime camera we may have in the area. We're speaking with not only multiple witnesses, but also some of the victims at this time. What we're doing is a collaboration of really search and rescue. We've cordoned off this inner perimeter right here that you are in. With the exterior areas, we're doing search and rescue for individuals that also may be having medical emergencies. So we're looking to address all of those concerns right now as well. As I said, we're canvassing the areas, we're reviewing the cameras. We're very early in this investigation. We did reach out to our group violence outreach team. They're also out here working with our other city partners in reference to outreach, education, and trying to figure out the root cause of what is going on right now. What I will say is, anyone that does have information in reference to this ongoing active investigation, they're asked to call Baltimore Police Department at 911 or Metro Crime Stoppers at 1-8667-LOCKUP, and I will pass it off to the Health Department. Thank you.
Hello everyone, Sarah Whaley, Baltimore City Mayor's Office of Overdose Response. Not the Health Department, but we are actively here partnering with teams from the Health Department, our community-based organizations, canvassing out from this area, connecting folks with Narcan. We're also passing out test strips, really just trying to engage the community to let folks know that if they are using today, that we don't know what's in the supply, and so for folks to be careful, if they're using to have Narcan available, use with someone else. If you see someone in your community that looks like they need help, make sure they call emergency services. And we'll have teams out from this area all day, so you'll see canvassers out from our community-based organizations and the health department. Thank you.
At this time, we'll take a few questions. We're going to start with Stefan over there and make our way over there.
Gotcha, Chief. Understanding that this is still all preliminary, what do you guys think was the drug of choice? We're also hearing that this may have been something that's been like cannabis. Can you confirm that?
Don't know what the drug of choice was, and I can't confirm anything at this point. Obviously we would need analysis, right? But right now we just don't have that information.
Chris, WBAL?
So you had mentioned, Chief, that this happened, the first calls were at 9:20 this morning. It's in the noon hour now, so this has been an ongoing situation, and for hours you were learning more and more patients as the hours was going on, or victims, I should say. Is that was the case?
Yes, sir. So a lot of the victims were located very, very close right in this footprint, but as we began to deploy in here, we also fanned out, and we started looking in areas along North Avenue, along Pensy, both subway platforms, and then kind of off the beaten path, down some of the alleys and things like that. So two things have happened. One, we have found more patients. Two, people have come to us and said, you may want to check over here, you may want to check there, which we've done.
Tommy?
Can you explain a response like this? This is obviously pretty large. Unfortunately, overdoses are something we see in our city. How big is this for your department to have 15 patients in counting?
So I'll speak for the fire department. This is a level 1 mass casualty incident. So for us, irregardless of the nature of the call, the amount of patients scripts how we respond to this. And we've done just that. As that number goes up, we upscale, but our initial responders recognized right away where this was heading, and they called for a lot of resources well in advance of us discovering the amount of patients that we've discovered so far. So the initial incident commanders have been very proactive, both police and fire. And then as soon as we got our arms around what was happening, then we involved the health department. We involved Director Whaley's team. So this is what we do. It's as it evolves, we change with the evolution, and it's brought us to where we are now. I can't hear you. No, not that we're aware of. There have not.
And then my question is, yesterday the city had its first public hearing on overdoses. There's a listening event. What does this all mean in the context of where the city is at now with addressing overdoses?
You want to take that, Director?
In the strategic plan,
Sorry.
In the strategic plan, we talk about interagency collaboration, breaking down those silos, and I think this is an example of us all coming together to collaborate to respond to the needs of the city and address overdose.
Thank you, guys. Thank you.
A crucial reminder here, help is available. If you or anyone you know is a victim of domestic violence, you can call the phone number there on your screen or simply text the word START to 88788.
Thanks for watching. We appreciate you. Please subscribe.